Hello everyone, welcome back to the channel. Today we're going to be learning about nephrotic syndrome, the next in the renal medicine series. So nephrotic syndrome, not to be confused with nephritic syndrome, is essentially a series of glomerular inflammatory conditions which present with a triad of proteinuria, hyperalbuminemia, and edema. They are caused by damage to the foot podocytes in the basement membrane, which disrupts the charge barrier within the basement membrane, leading to the leakage of proteins into the basement membrane, leading to proteinuria. Now, there are both primary and secondary causes. The primary causes include minimal change syndrome, which is the most common type of nephrotic syndrome commonly seen in children, membranous nephropathy, which is associated with autoimmune conditions such as SLE and thyroid disorders, and focal segmental glomerulosclerosis, which is the most common type of nephrotic syndrome in adults, particularly patients of Afro-Caribbean, American, and Hispanic heritage. Some of the other secondary causes of nephrotic syndrome include diabetes mellitus, infections, particularly HIV, hepatitis B and C, systemic lupus erythematosus, and amyloidosis, as well as malaria. We can remember some of the other presentations of nephrotic syndrome using the mnemonic HELP. H stands for hyperalbuminemia and hypercoagulability, which can be detected if there is low levels of albumin, protein C, protein S, and antithrombin 3 in the urine. O stands for edema. L for lipid abnormalities. In particular, we want to be looking out for hyperlipidemia, which can be suggested if there's increased LDL cholesterol in the blood or suggestions of oval fat bodies within the blood, and proteinuria. And this basically is the main difference between nephrotic and nephritic syndromes. In nephrotic syndromes, there is high levels of proteinuria, whereas in nephritic syndromes, which is more caused by an inflammation of the glomerular basement membrane, we'll find greater levels of hematuria and other symptoms such as coke-coloured urine. So to investigate nephrotic syndrome, we can do a series of bedside bloods and imaging. Bedside tests include urine dipstick, a midstream urine sample, 24-hour urine collection to look for proteins in the urine. For bloods, we can particularly look at the patient's U's and E's, their coagulation screen to check for hypercoagulability, their protein to creatinine ratio, and they should also have low total thyroxine levels in nephrotic syndrome. The most definitive investigation is usually a renal biopsy. And in terms of management, firstly, we want to conservatively manage the condition through managing underlying conditions that may contribute to it, such as diabetes and hypertension. And then medically, we can target and treat the nephrotic syndrome depending on the type of cause it arises from. So for minimal change syndrome, we want to treat the patient with high-dose corticosteroids, particularly prednisolone. For membranous glomerular nephropathy, we want to control the high blood pressure, so give them ACE inhibitors as well as control with steroids. And for focal segmental glomerulosclerosis, again, we want to treat the underlying conditions, so reduce hypertension through prescribing ACE inhibitors and angiotensin receptor 2 blockers, and steroids to reduce any inflammation. Diuretics can help the patient to pee out any additional fluid in the body, such as edema, and we also want to be managing their cholesterol and sodium intake to reduce the levels of lipids in their body. The most common complications of nephrotic syndrome include AKI, venous thromboembolism, increasing infections, protein malnutrition, and hypovolemia. Now we can go through some of the three most common types of nephrotic syndrome. And here I've listed their associations. So in minimal change syndrome, it's got minimal change under light microscopy, and it's the most common seen in children. It's often associated with Hodgkin's lymphoma and recent infections such as immunization. Some buzzwords to look out for in exam questions include negative fluorescence, an effacement fusion of foot podocytes, or a normal appearing glomeruli can suggest minimal change syndrome. It's almost in the name, there is a minimal change in the appearance of the glomeruli. With membranous nephropathy, I like to use the mnemonic "I'm a proud member of the Spike and Dome Club" to help me remember the kind of associations and the buzzwords. I stands for infection, particularly HIV, as well as protein S, protein C, and antithrombin 3. M for medications, particularly the medications that can lead to membranous nephropathy, include penicillamine, NSAIDs, Gold, and captopril. A for autoimmune conditions, particularly SLE. And P stands for its association with phospholipase A2 on podocytes. Member helps me to remember all of these is associated with membranous nephropathy. And the most common and very high yield buzzword to look for is that under light microscopy, membranous nephropathy looks like a spike and dome appearance of the subepithelial deposits. And in terms of focal segmental glomerulosclerosis, is the most common type of nephrotic syndrome in adults. It's commonly associated with African Americans, Hispanics, patients with HIV and sickle cell disease. And some buzzwords you want to be looking out for in exam questions that can suggest focal segmental glomerulosclerosis include hyalinosis and segmental sclerosis, effacement of foot podocytes, non-specific IgM, C1 and C3 deposits in the mesangial matrix. This table kind of just summarizes what each condition looks like under light microscopy, in which patient demographics is most common, and also some of the buzzwords you want to be looking out for when answering exam questions. And finally, the two other types of nephrotic syndrome include diabetic nephropathy, and this is typically presents as Kimmelstead-Wilson nodules under light microscopy, which can also be described as sclerotic eosinophilic nodules with a central acellular region, and also amyloidosis, which is associated with chronic inflammation and can have AA proteins, or multiple myeloma, which could present with AL proteins. And the buzzwords we want to be looking out for in amyloidosis is that it's associated with apple-green birefringence under light microscopy. Thank you for watching. This was a brief summary of nephrotic syndrome, the different types, some of the buzzwords we want to be looking out for when answering questions to do with nephrotic syndrome, and also a summary of the differences with nephritic syndrome. Thank you for watching. Please comment down in the comment section below if you have any questions. Thank you.